Tonight at 10, more than 50,000 new cases, yet another UK record, as the full extent of the COVID crisis in the NHS is exposed. There's unprecedented pressure on hospital services in many areas, with patients stuck in ambulances, and experts warning that more measures are now needed.
We're likely to see similar, if not higher, numbers of deaths in the coming months to those that we saw in the first wave, unless we take dramatic, decisive action to increase the level of restrictions.
Public Health England says the latest figures are of extreme concern ahead of tomorrow's announcement of possible changes to England's tier system. And in schools in England, more calls to delay the start of term amid confusion over plans for pupils' COVID testing. Rescue workers find more survivors of an earthquake in Croatia, which destroyed many buildings in the central town of Petrinja.
Another leader of the fashion world in Paris, Pierre Cardin, takes the town by storm and reveals to...
And one of the greatest names in fashion design, Pierre Cardin, has died at the age of 98. Good evening. The full extent of the COVID crisis facing the NHS has become more apparent today. More than 50,000 new cases were reported in the past 24 hours. That's yet another record for the UK and a matter of extreme concern, according to Public Health England. The head of the NHS in England says that health workers are once again in the eye of the storm, while a leading scientific advisor to the UK government says urgent action is now needed to prevent what he called a catastrophe in the new year. Any changes to England's tier restrictions will be announced tomorrow. Our health correspondent Catherine Burns has the latest.
We all wanted to have a few days off over Christmas, but instead have been asked to come back to work.
This time it's a wave. This time we've seen a massive increase.
If we continue with the current rate of admissions, we are very, very close to becoming overwhelmed.
So it is affecting anyone and everyone.
People are just beginning to be exhausted. It's been such a long year.
Doctors and nurses from the NHS frontline telling us what it's like dealing with a pandemic that after months and months of hard work is getting worse. Queen's Hospital in Romford today, 20 ambulances waiting outside, some on double yellow lines because the parking bays are all full. At one stage, you can see staff bringing hot drinks out to patients waiting in the ambulances. The hospital says they were being cared for safely, but that it's under considerable pressure and is asking staff to take extra shifts. It's a similar picture across London and the southeast of England.
I'd say this is the most challenging extended period that I've ever seen, and I'd like to just take the opportunity to pay tribute to the staff who have worked phenomenally hard and well.
More than 21,000 people are being treated in hospital for COVID across the UK. In Wales, they're dealing with their highest level of patients now.
The patients who are coming to ITU now are a degree sicker. A lot of them are desperately unwell. And we've seen a real reflection of that in the amount of patients that have died.
In Northern Ireland, hospitals say they are under pressure but coping. And in Scotland, people are being asked to stay at home over New Year as cases hit a record high. This new surge in cases couldn't come at a worse time of year for the NHS. Winter always brings extra pressures with more respiratory illnesses, as well as slips, trips and falls in icy weather. This year, on top of that, and the pandemic, social distancing means hospitals need to keep patients further apart. And the NHS in England is operating with around 10% fewer beds than usual. In England, 24 million people are already living under Tier 4 restrictions, the highest level. The government is about to decide if that's enough. And this warning from a scientific advisor: act now to avoid catastrophe in the new year.
In my view, if we don't introduce tougher restrictions in areas in the north and areas that are not currently in Tier 4, they will rise to very high levels of disease and hospitalisation, similar to those seen in London.
The NHS Chief Executive's annual thank you message to staff acknowledges that this year has been the toughest that most can remember. But there's hope too.
By late spring, we think that with vaccine supply continuing to come on stream, we will have been able to offer all vulnerable people across this country this COVID vaccination.
3 weeks ago, Margaret Keenan became the first person to have a COVID vaccine outside of clinical trials. Today, she's had her second booster dose, a real piece of good news. But now millions more need to be vaccinated too. Catherine Burns, BBC News.
Well, 1,500 military personnel are to help with the rollout of mass coronavirus testing in schools in England next month. They will hold online advice sessions and give telephone guidance to staff, with children mostly carrying out the test themselves. But teaching unions say that schools have not been given enough time to make plans, and some head teachers are calling for the government to delay the start of term. Our political correspondent Damien Grammaticus has the story.
Empty classrooms now, but will it be safe if millions of children start filling them next week? Or could these become incubators for the new, more infectious strain of COVID-19? The current plan is for a staggered return with mass testing of secondary pupils and staff. In many cases, children themselves carrying out the tests under supervision.
It's not going to be easy. It will be difficult. We are in a national emergency, but it will make a huge difference to teachers and children, and hopefully mean that schools will remain open.
The government wants children back. Homeschooling for many isn't viable, lacking the support and the space, the computers and iPads to make it work. But scientists, unions and head teachers are all urging a delay. For now, the idea is that the military, who've already been running testing, will help, not in schools, but remotely, giving guidance online or over the phone. And the plan envisages less than one soldier per school.
We're educationists. We can support the government. It's good we're going to have some members of the army, but for 3,500 secondary schools, 1,500 troops doing webinars probably isn't the government response that we were looking for.
In some parts of the UK, the return to school is already happening later. In England and Northern Ireland, children are due to start next week. In Wales, most should be back by the 11th of January. In Scotland, it won't be before the 18th. Many head teachers want more time to prepare.
Things have just come through to schools very late, and I think it's certainly led to a lot of stress and a lot of panic over the Christmas holidays to try to get people recruited. Our community have been excellent since we've had press coverage, and since we've talked to our community. We've had some volunteers, but we've still got nowhere near enough.
Schools have stepped up right the way from March, delivering online learning, turning things at the turn of a coin. We're very used to being adaptable. We really want this to work, but we don't know where we're going to get the volunteers from.
If there is a delay, primary schools and children of key workers may not be affected. But in secondaries, it might mean online learning or even an extension to the holidays for a week or two, then those taking exams back first. An announcement could come as soon as tomorrow. Damien Grammaticus, BBC News.
Well, let's take a look then at the latest government figures, and they show that there were 53,135 new infections recorded in the latest 24 hours. But not all of the four nations reported the full set of data over the Christmas period. The average number of new cases reported per day in the past week is now 38,936. 414 deaths were reported. That's people who died within 28 days of a positive COVID test. It means on average in the past week, 466 deaths were announced every day. And it takes the total number of deaths so far across the UK to 71,567. And with me is our health correspondent, Catherine Burns, whose report we saw a little earlier. So we have this record number of infections today, Catherine. And tomorrow, of course, we're looking ahead to the announcement on tiers in England and possible changes there. So where do we stand, do you think?
Well, let's start with those numbers. Those number of people testing positive, 53,000. I mean, there was, like you said, there was a bit of a lag over Christmas with some nations not reporting their data as quickly. But let's be very clear about this. Public Health England says this is a real increase and is of extreme concern. And there are some things that we just don't actually have an accurate picture of right now. For example, how many people are being treated in hospital for COVID? So the latest figures we've got, just over 21,000, they're a week old now. And at that point, we were just a few hundred cases shy of reaching the level we got to at the peak back in April. Now, since then, England's had an extra 2,000 cases. So it's pretty reasonable to expect that we have now broken that record. We've gone past that peak, which obviously is another record that nobody wanted to break. So where does all this leave us? Well, we know the government has, Boris Johnson, he chaired a meeting tonight looking at the tier system in England, and we're expecting an update from the Health Secretary, Matt Hancock, tomorrow. So right now, we've got about 40% of the population in England in Tier 4, the highest level of restrictions. And some people are questioning, is this going to be high enough? Another thing that I think we should look out for tomorrow is areas where there are really high numbers of people testing positive, but are still only in tiers 2 or 3. So an example of that is Eden in Cumbria. It's having about 500 cases for every 100,000 people right now. And to give you some context, the UK average is more like 400. But really, for all of us, no matter what tier we're in, what level of restrictions we're looking at, right now, it's time to go back to the basics. Stick to the rules for the area that we're in and go back to those basics. Washing hands, social distancing, wearing masks, everything to give us a fighting chance to get these infections down.
Catherine, once again, many thanks. Catherine Burns there, our health correspondent. Well, in Scotland, the public there have been urged to stay at home on New Year's Eve, not to celebrate Hogmanay with other households. The advice from the First Minister, Nicola Sturgeon, follows a record number of COVID cases reported on a single day in Scotland.
My main message to people really is to make sure that you are not visiting other people's houses right now. That is the most important thing of all, and unfortunately that includes Hogmanay and New Year. This year I know we're all desperate to kick 2020 into touch, but we must do that safely, and the safest way to do that this year is to be in our own homes with our own households.
First Minister of Scotland there, live to Glasgow, and our Scotland correspondent Alexandra Mackenzie. The message from the First Minister very clear, Alexandra. What is the position there now?
Well, Hogmanay should be about visiting friends and family, but not this year. There's an increasing rise in the number of cases throughout most of the country. And today, Scotland recorded its highest daily number of cases. That was almost 2,000 cases. And a quarter of those were here in the Greater Glasgow and Clyde Health Board area. Though Nicola Sturgeon has said she's also concerned about other places. She's concerned about Shetland, Dumfries and Galloway, and also the borders. On a more positive note, she said that hospitals are not being overwhelmed, although we certainly should not be complacent about that. She's also said that it's hoped that the virus can be suppressed because of the strict restrictions that we're under, but it is also feared that come January the NHS could struggle and we could have a tricky few weeks ahead.
Alexandra, many thanks once again for the update there. Alexandra Mackenzie. Well, the House of Commons will vote tomorrow on the new trade agreement struck by the UK and the European Union last week. It's expected to pass with ease, not least because the Labour leader, Sir Keir Starmer, has instructed his MPs to back the deal that was struck by Boris Johnson. But Sir Keir is likely to face a limited rebellion by some of his colleagues who are determined to vote against what they say is a bad deal for the UK. Let's talk to our political correspondent, Jessica Parker at Westminster. It's going to be a very big milestone in parliamentary history tomorrow, Jessica.
Yes, it is. And look, Boris Johnson already looked like he had the numbers to get the deal through, but he'll be heartened today after getting the backing of a group of Conservative Eurosceptic MPs known as the ERG. But it does look like the deal will race through this place tomorrow. But, as you say, Brexit's still throwing up some divisions. Sir Keir Starmer has ordered his MPs to back the agreement. He's described it as thin, but he says it's better than a no-deal outcome. But he also says that he doesn't think that Labour should be sat on the sidelines by abstaining. But it does look like at least a handful of his MPs will defy him tomorrow. Some of them arguing, well, if the deal's going to go through Parliament anyway, why put their name to an agreement that they think will be bad for the country? Now, of course, the UK did actually leave the EU back in January, but it's in 2 days' time, when the transition period comes to an end, the UK actually starts to extract itself from the European Union. So whether on immigration, whether on fisheries, whether on trade, that is when the relationship fundamentally begins to change. And after the years of political debate, even at times political turmoil, that's when the country really begins to find out what Brexit means.
Jessica, many thanks once again. Jessica Parker there at Westminster. At least 7 people have been killed and 20 others injured following an earthquake in Croatia. The tremor, with a magnitude of 6.4, destroyed many buildings in the central town of Petrinja. The effects were felt in the capital Zagreb, where there were power cuts, and more than 100 miles away in neighbouring Slovenia. Our correspondent Keith Doyle has the latest on this.
A man is rescued from a crushed car. He is reunited with his child, who had already been pulled free. It was a little after midday when the 6.4 magnitude earthquake hit, the strongest to hit Croatia in decades. The town of Petrinja took the full force. Half of its buildings have been destroyed, according to the mayor, who was talking to reporters when the quake struck. A 12-year-old girl died. These women were able to walk away from the collapsed town hall. Others were moved to safety however they could be. Rescuers from all across Croatia searched amongst the rubble for survivors. This man said, "I don't have anything left. Everything crumbled." In the nearby city of Sisak, the mayor was holding a news conference when the tremors started. The main hospital here was badly damaged. It was also felt hundreds of miles away in the Slovenian Parliament building. The town of Petrinja was almost destroyed during the brutal civil war in the 1990s. Today's earthquake has brought devastation here once again. Keith Doyle, BBC News.
A group of interpreters who worked with the British Army in Iraq say their lives have become unbearable since the UK unit that they worked for left the country in July. They say they're facing death threats from powerful militia which back Iran. As our correspondent Nafisa Konavad reports now from Iraq.
Over the past 6 years, the British Army has trained more than 100,000 soldiers in Iraq as part of its mission to defeat so-called Islamic State. Such work is impossible without Iraqi interpreters. But now 8 of them live in fear.
At any time, someone will knock on the door of my house and fire 5 bullets. 1 bullet for me, 1 bullet for my wife, and 3 bullets for my 3 daughters.
The security situation collapsed after the killing of top Iranian General Qasem Soleimani. He was assassinated in a US drone attack in Baghdad almost a year ago, angering pro-Iran paramilitaries.
They released a statement calling on all Iraqis working with coalition forces to cooperate with them. There was a hidden message: if you don't cooperate with us, we will consider you an enemy.
As coronavirus hit Iraq, the country went into lockdown. The coalition gave a list of the interpreters' names and ID numbers to the Iraqi security forces. This was supposed to help them pass through government checkpoints. But some armed groups linked to Iran are also part of the Iraqi security forces. The groups which had already threatened the interpreters now knew their names. I raised their case with the coalition.
We protect their personal data. We do not pass that to checkpoints. We do not pass that to other organisations, include the Iraqi security forces or government services.
But the document I have seen is coming from the US Embassy. It looks genuine. I checked.
Then I would have to look into that further.
In a statement, the British Ministry of Defence said it takes any breach of personal security extremely seriously. It's investigating the allegations. Western troops, including the British Army, then began leaving Iraq. The interpreters were left unemployed and unprotected. The last time the British left Iraq in 2009, at least 40 interpreters were killed by militia groups. Ahmed and Ali say they don't want their names added to that list. Nafise Kohnavard, BBC News, Iraq.
One of the biggest names in 20th century fashion, the celebrated French designer Pierre Cardin has died at the age of 98. He transformed the world fashion industry from the 1960s onwards. Our correspondent Daniela Ralph tells us more.
Another leader of the fashion world in Paris, Pierre Cardin, takes the town by storm and reveals to breathlessly excited womanhood what they simply must be wearing by Easter.
Pierre Cardin, the fashion world's supreme innovator. For decades, his designs ripped up convention and shocked the establishment. His thirst for the new and surprising was never satisfied. Born in 1922, he left school at 14 to train in making cloth. A fortune teller told him he'd be famous. He asked if she knew anyone who worked in fashion. She did. He moved to Paris, clutching an address. He designed costumes for Jean Cocteau's film Beauty and the Beast in 1946 and was soon unnerving the fashion industry itself. His 1950s bubble dress took liberties with the female silhouette. He moved young men out of boxy jackets, creating a new look for the 1960s. The Beatles, in their collarless Cardin suits, said he was one step ahead of tomorrow. He irritated his fellow high fashion designers, launching ready-to-wear collections for the middle classes, and indulged in futuristic fantasies inspired by the space age, some of it impractical to wear. This was his proposed uniform for nurses. He was a savvy businessman, showing this 1970s collection in China, where fashion was set by Chairman Mao. But he spotted potential.
We are expecting in the future, not for tomorrow, but I'm sure in 10 years, China become the most important country in the world.
Cardin established licensing agreements, putting his name on everything from glasses to fancy carpets. It changed the way the industry worked. He bought a castle, once owned by the Marquis de Sade, putting on shows there into his 10th decade. Still experimenting, still innovating. Pierre Cardin capturing the future before it exists.
The renowned French fashion designer Pierre Cardin, who's died at the age of 98. And that's it from us tonight. Now on BBC One, it's time for the news where you are. Have a good night.